So with that being said, I'm going to introduce Dr. Peter Russell, who's going to come up and talk a little bit about the typical students that we see here.
Great, thank you. Yeah, as you can tell, I'm a psychologist. I'm not a specialist with any of this mechanical setup, computer. We had a tech come and push one button, and I guess he repaired everything that we weren't doing correctly. But I, like Tiffany O'Hara and Pat Thompson, I'm a psychologist with Counseling and Psychological Services. We're located centrally in Galvin Hall 190, where we have a central office, and then we have psychologists in community centers here on campus and also in every college. We do see students who present to us with a variety of concerns, many of those occurring pretty recently because when students usually come to this institution, they're 18 to 23, generally as undergraduates. There are some people that don't fit into that category, but most students that come for their undergraduate education are around this age group when we might see some concerns that they first manifest. And we have a list of some of those that occur and where they typically occur. For anxiety disorders and bipolar disorder, we may see this occur even sooner than 18, but the average age of onset would be 18. Depression, as I've seen quite a bit on campus, might occur earlier. I have students who are undergraduates who are 18, 19, and they have a history of depressive episodes really since age 10 or 11. But the average age of onset for depressive episodes that would be cyclical and episodic, reoccurring, would be between 20 and 26. Eating disorders might emerge earlier, 13, 20. Schizophrenia or thought disturbance would occur at the average age of 21. And sometimes we see students, they have their first psychotic break, and they have trouble distinguishing between reality and fantasy or psychotic process at age 21. Drugs and alcohol abuse can happen at almost any age. And personality disorders can be occurring, see patterns or ways of dealing with the world and others that occur earlier, but might really come to represent some problematic interactions between 18 and 25. So those are some of the issues that we might see. From looking at the data and surveying students, what are some of the issues that are reported as most problematic to students and might interfere with their performance academically? And what's the number one? Stress. So it's a great thing that we have wellness peers that work with stress. Many psychologists on this campus work with students who are stressed. One of the things that we see when students are stressed and living in communal environments, they don't sleep well. Sometimes it's noisy, sometimes anxiety or depression can interfere with sleep. And cold flu is a physical concern that interferes quite a bit with people's performance and their state of well-being. And it is up there with some of the psychological concerns as well. Relationship difficulties we can talk about because those occur at quite a significant rate in terms of who's presenting for counseling as well. If you see some of the other issues listed here, I'm not going to go through all of them. In the National College Health Assessment Survey, it was noted that when you survey students and ask them what their experience has been like, a very large percentage will talk about having difficulty. And notably, the first one, students report feeling hopeless at times. In comparing to some of the other campuses that were surveyed, we see 63% in San Diego, so that's pretty high, and that's above the mean at some of the other institutions that were surveyed. There were times when students felt overwhelmed by all that they had to do, and again, UC San Diego reported at a higher rate than other institutions. So basically 9 out of 10, almost 10 out of 10 people feel that they're overwhelmed so much that they can't function well. Felt exhausted, not because of physical activity. Again, UC San Diego is right up there. That fits with my experience working with students. At times they feel very overwhelmed. And if you ask people if they've been so depressed that it was difficult to function, almost half of the sample will tell you that they've had that experience. We have just a little bit higher rate than some other of the campuses surveyed for those reporting that they're in therapy for depression. And we're pretty consistent with the other cohorts when it comes to taking medication for depression, having the experience of considering suicide or attempting suicide, seriously considering it, and just a little bit below the attempted suicide rate, a little bit below the cohort average. So I don't want to spend too much time. I just want to run through very quickly, and you may see that the age of people who present, some of these averages from 18 to 21, 41%, we see 22 to 25, 32%, and over 25, 27%. That has a lot to do with the population who's here. It's not uncommon to see more women than men. For many women, the process of engaging in discussion directly face-to-face is a process they may be more comfortable with than men. So men tend to come to counseling in lower rates. That's not unusual. On campus, off campus, everybody can present concerns regardless of where they live. And who is referring people, it looks like the largest percent is referred by self. So other people are helping quite a bit. People get into treatment or get more support. But most of our students here will present themselves when they know that they're having concerns and need that support. Who comes in for services? As you're in school longer, perhaps the stress is cumulative. People become more comfortable coming forward and asking for help. And graduate students are very comfortable coming forward and asking for help. And their stress level just increases. We see some of the other groups represented: the School of Medicine, Scripps Institution of Social Honesty, and non-students. And some people will not state. We usually see people who are registered students. If they're a non-student, we usually see briefly to refer to whatever services they're eligible for, or they might be a spouse or significant other of a student. Presenting problems. Some people are surprised that the most frequent presenting problem would be relational. Relationship with parents, relationship with significant other, getting along with people, wanting better interactions with people, followed by mood disorders and anxiety disorders. But as you can see, there are all sorts of different issues that will present, and each person will represent quite differently. But those are some of the top presenting